We'd like to welcome you to the Healthcare Revolution podcast, where we empower you to take control of your health, restore your trust in the medical system, and achieve lasting wellness. I am your host, Brad Powell, Doctor of Physical Therapy and owner of an award-winning foundation physical therapy here in the Salt Lake Valley. Each episode, we dive into all things rehab prevention, overall health, bringing you expert insights from leaders across the healthcare fields. Please note, while we aim to provide with the best knowledge and advice, the opinions shared represent those of experts in the field and are not to be replaced with professional medical advice. So let's revolutionize healthcare and wellness together.
I don't think AI should ever be used as a tool, but more of as what we would call a teammate. And I think that's what a radiologist is going to lean into AI with. There was a lot of debate, probably 6-7 years ago, about AI was going to replace radiologists. I don't see that. It absolutely will aid them in diagnosis, which is fantastic, on their end. But I don't see a replacement. The thing is, we're all getting older. Things start to compound when you ignore them. It's really you do hope that people take their health seriously, because it's just that one thing. It doesn't matter who you talk to. The wealthiest people in the world who have everything, supposedly, when they lose their health, there's everything. Nothing matters.
Welcome to the Healthcare Revolution podcast. I have here with me Ted Kyle, who is the VP of Operations for Rayus Imaging. And today we are talking about concussions and the unique technology that is now releasing that is giving us more insight into concussions and treating them better than ever before. So welcome, Ted, to the podcast.
Thank you for having me.
It's great to have you here. I'm excited to have this topic with you.
Brad.
I had no idea when I first met you, I had no idea you had this clinical background too.
Yeah.
Tell me about your clinical background.
I tell everyone I started out life as a chiropractor, right? And that's where I started, and practiced for many years. And it was a real enjoyment for me.
What's interesting is you say that.
Yeah.
The revolution is all about becoming better, right? Mm-hmm. As soon as you said that, my natural tendency was to say, I won't hold it against you. But then I'm challenging myself constantly and realizing what that statement does. Mm-hmm. You know what I mean? Mm-hmm. Even knowing it's all fun and games, it's purely not creating collaboration, right? Because it's essentially picking on that profession, saying it's lesser. Mm-hmm. But ultimately, the revolution is all about working together as a team, that we're hand in hand doing this together. So I apologize for that thought, but I also wanted to just talk about that. Even though we have those thoughts, that's a bias that we all have as PTs, and we need to drop those things and build this team together. So I just wanted to highlight that as I just thought about that. So anyways,
I appreciate that transparency there. That's great. And I fully understand that. But yeah, and I that's kind of where I started with clinical, and I morphed from there. I had a huge passion really for radiology, even when I was in school, but I'll say how I got into that profession, into radiology, and being my space now, was really just out of frustration with the model at the time. And I'm going way back in time.
How many years ago are we talking here?
Almost 20 years here. It is 20 years actually. We're getting really close to the 20-year mark this year. But yeah, I was frustrated with the medical model and what my patients were going through when I would send them for advanced imaging.
Yeah, tell me the top things you were frustrated with.
Quality of the interpretation and how it fit my patient.
Specifically with concussions?
Oh no, everything, and their patient experience. I wanted them, they weren't having a great experience when I would send them out for advanced imaging. Yeah. And I'm like, I could do this better. Yeah. And that's really how it all started,
I was just having this conversation, literally driving here with one of my patients. She has Select Health insurance. Yeah. And a plan that Rayus doesn't take, and I use Rayus for everything. Yeah. I think I sent maybe 7 X-rays, MRIs this week. Yeah. But this particular patient, the Rayus can't take that insurance because you guys are essentially blocked out of that insurance, right? And I just told this patient, I'm like, hey, have you called the imaging center yet? But I sent in this referral 2 days ago. They haven't even heard from the imaging center. I'm like, what is going on? But also I know I've worked with this imaging center long enough that I know they don't really contact patients for like 14 days. Yeah. And I want this imaging now because I want to act clinically and I want to figure out what's our next step. Yeah. So I put the patient on, I put my front office manager on, and I have them call the imaging center every day. And sometimes it takes 5-6 calls to get scheduled. And I totally get this frustration as a provider because we need that information now. You know, people got lives to live.
You do. And the thing that a lot of places tend to forget is that patients are in pain too, right? Mm-hmm. And so there's always the question for them. They're afraid of what, they're honestly a lot of times afraid of what's going to be on the MRI. You know, there's some fear there. And I think our staff is really well educated on that mentality, that they understand the patients are, one, typically in pain, and then they're a little worried about what we might find on the MRI. So we kind of go into it with that.
Yeah, and if I say I want to order imaging, and then the patient has to wait 14 days, what are they thinking about in this next 14 days?
Those 14 days are long. Yeah, they really are. So yeah, I can appreciate that. And so, I mean, it's one of the things that we built the business on. Obviously, it's very patient centric, and you know, we didn't start out as Rayus. Our first rendition, we were US MRI, and that's what we were for about 15 years before we merged. Remember.
So your office in South Jordan, if you look at our lighting in our desk as you came in this morning, I know you recognize it. Yeah. That idea came from your space. Yeah. And the black lights, I'm sure you can see some similarities. I walked in and I saw a picture of it online and I thought, I need to walk in there because I'm designing my first space, my first clinic. Yeah. And I saw the way it had looked and I loved the look. There was these black, I can still see it today. There's these black lights with gold on the inside. Right. And then you had the desk that was lit up. And I was like, that's gold. Because I wanted people to feel enlightened as they came in the clinic. Right. And that's where I got my idea from. Yeah, I love that. So thank you.
Yeah, well, you're welcome. I thank you for copying me. I mean, that's a huge compliment, honestly. And yeah, your office here is beautiful. I noticed it right away. I didn't notice that it was a copy, but it is beautiful. Maybe I just connected.
It wasn't like a stolen idea; it's an evolution of an idea. You know,
right? Yeah. Yeah. And that was our original site, actually, South Jordan. But we built our centers, honestly, to be very different than something you would walk into in a hospital. They're very open.
They're so comfortable.
Open and bright. And
because people get scared. They're scared. You know, like if they're in an MRI and in this tube, they hate getting them, right? And the more comfortable you make them at the front. I mean, I'll order an image and people will be in Rayus within like 2 hours. I'm like, what is happening? Yeah. Right? And that's so incredible. And obviously there's some insurance stuff that needs to off sometimes. Yeah. But most of the time I'm sending the referral and the patient's going right to the facility, walk in. Yeah. We call before, make sure there's no authorization, but they get it same day. And I get the results within like 24 hours. Yeah. If I put stat, I get it that night. Yeah. It's incredible. So you guys are running a great business model. I love
it. That's so good to hear. Yeah, that's fantastic.
But yeah, tell me more about your career and how this evolved. What, you know, you were thinking in the beginning there, you had issues with access, you had issues with the quality, like these were all frustrations. So you built this business model to improve the patient experience. Yeah. And then you stopped being a chiropractor.
I did pretty quickly
and then because transitioned over to the imaging full time.
Yeah, imaging was a full time gig. You become an entrepreneur and your life becomes that. And you know, and it's funny, I had this conversation with my wife just the other day. Like I said, you know, sometimes I kind of miss those early days, you know, with all because it was so easy. You know, we had one center and it was, you were just so in the thick of it. And she's like, I don't miss it at all. She's like, you were terrible.
Patient care aspect.
Yeah, she's like, you were gone all the time. And it's true. I mean, it takes a lot of work to launch something like that, but it was fun. We jumped early on. We built the place. Really, I did originally to help chiropractors because they didn't have good access. They didn't have good reads from the radiologists. They didn't connect well. Yeah. So that was the goal. And then other practitioners started taking note. You know, all of a sudden the orthopedic surgeons are sending to us because our quality was high and access was good. And then we jumped into the sports world in a heavy way. in those early days, and we connected the the Olympic teams.
Yeah, you work with the speed skating team, right?
So
What's
I'm
your
medical
role in
director for them. Yeah,
awesome.
and that's an absolute
tell
joy.
me about the role as a medical director.
It's literally one of the best experiences of my life.
Yeah, to be the medical director of the Olympic speed skating team.
Yeah,
right?
and
Is that correct?
Yeah, and
That's amazing.
It's because you get to see these athletes who are, in my opinion, the most humble athletes on the planet. I do believe that.
Yeah.
And
I've worked with some speed skaters.
Have you?
We've done some unique training. They'll bring in their harnesses.
Oh,
and,
right.
I'll strap them to that harness, and it gives me the biggest quad burner. I have to like pull back so hard, and they're laid, at that 45-degree angle and just pushing hard. And it's everything I got to resist them.
They're strong.
Because I want to see, they're super powerful, especially in those certain ranges of motion, right?
Yep.
Those ranges of motion most people aren't powerful at, but in that one, they can do it. I don't even know how long they go. Like, what are the sprints that they do?
Well, there's all kinds of different distances, and again, depending on which discipline they're doing, can make a huge difference in how they're almost how they're physically built, right? Because there's short track, there's long track, the long distance ones, the short fast ones. But what's interesting about them is, and I learned this early, is you always think you want every athlete balanced, right? Like left, right, exactly the same. Well, they're always doing left turns. They can't be symmetrical because they are obviously going to be dominant a certain direction.
Yeah. Why don't they go both ways? Well, why don't they have the oval going one way one year and then the oval go
I think it would mess them up mentally, honestly. But they're a good group, and you get to really get to see that these people, they represent the United States. That's what they do. They're not. There's no money in it typically, and they're on this weird 4-year cycle. Like they can either make the Olympic team, after that 4-year cycle is hard. Yeah. Let alone podium at the Olympics and get a medal. But you see them try, and those 4 years go by, and maybe they don't make the team. And then they're back at it. They start over.
So hard for years. I have this patient that's been preparing for 4 years to be in the Olympics this next cycle. Yeah. And he's just trained and trained and trained.
It's like that.
I am blown away with what it takes to be an Olympian. It's pretty incredible.
And the respect you have for how devastating an injury can be, right?
Yeah, and because how it sets you back.
The timing of it, if it's an Olympic year and you're months out.
Yeah, 3.5 years in training, and then you get hurt.
All the time.
It's terrible.
And then the decision making there too, when they're injured and they're maybe a year out or a season out from the Olympics, and do they get the surgery they may need? Can they recover in time and train? And I've seen that happen many times, and it's hard. It's hard to decide, do we do the surgery on this person? Ultimately you leave it up to the athlete, but there's a lot of really good physicians involved with U.S. speed skating. They're fantastic.
Well, we're going to dive into our topic of this invisible injury, right? Yes. These concussions. But I really want, can you summarize for us what your role as VP of Operations is? Like, what is it you're trying to change in the healthcare system or revolutionize? Yeah.
So I'm going to correct you. So VP of Operations was early days, and I'm now the VP for strategic growth for the company nationwide.
Okay.
Yeah. So what that means, I always joke about that, what that really means, because it doesn't seem like anyone really knows. But it's growth
really an expansion. It's replicate.
It's really growth for me. The way I look at it is growth in the industry, especially in technology. Yeah. And so where are we going to be?
So more in technology rather than actual growth of spaces across the nation.
I'm involved in that a little bit, but where I spend most of my time is, you have to look in the crystal ball and say, where are we going to be? Where is technology going to be in 5 years and 10 years? Where are we positioning ourselves now to be prepared instead of being reactionary? You have to really look ahead and say, where's our investment going to be? What technologies are in the future that are going to be the most dynamic and helpful to patients? How do we help them more? And how do we invest now? Because, that stuff changes so rapidly. And I've been in this industry for 20 years, and I can tell you exponentially now. I always say this technology grows exponentially. It's sort of like MRI machines are like iPhones, right? You have one year, and the next year it's sort of not obsolete, but the software becomes, there's new software. And
how much are these MRI machines?
Oh, they're a lot. They're a lot. Millions.
Idea. Millions of dollars.
Yeah, millions.
That's wild. And then you're thinking like the technology goes out of, it updates the next year.
Yeah.
You have to get new MRI machines or just software?
It's a software. Okay. Thankfully.
Yeah.
Thankfully. Otherwise I don't think anyone could afford to be in the industry. But the software, they're proud of the software too, every time a new rendition. But it's always growing fast. Last few years, that has leaped quite a bit. And I think that's going to continue with the introduction of AI, which I think every industry's probably seen that in some way. Healthcare, you name it. But on the MRI end of things, in the last 2 years alone, AI software has been introduced that has made tremendous advancements, not only in quality, but in time and efficiency. There's so much.
Do you foresee AI taking over radiologist jobs?
I don't. There's been a lot of debate.
How do you feel they are going to go hand in hand together?
Yeah, I think they're going to. I always look at AI. This is my perspective, and I'm stealing this, but I don't think AI should ever be used as a tool, but more of as what we would call a teammate. And I think that's what a radiologist is going to lean into AI with. There was a lot of debate, probably 6-7 years ago, about AI was going to replace radiologists. I don't see that. And I think that profession is probably feeling the same way now. It absolutely will aid them in diagnosis, which is fantastic, on their end. But I don't see a replacement, you know?
I mean, ultimately, there's an insurance company, you probably know this insurance company that tried to replace PT with virtual PT. Yeah. Essentially AI-driven PT, and it kind of flopped on its face. And, I tell patients this all the time because, patients will ask, like, can I just YouTube a bunch of back exercises? It's so customized. Every person's different. And even a skilled therapist can over-progress you or under-progress you and make it worse or not improve it, And it's so hard to get those things dialed in. AI can do the best that it can, but it can never replace the human, right? It's supposed to make us more efficient, not to necessarily replace what we do.
Yeah, the
people are
efficiency
using
part.
AI at home to self-diagnose, and that can be helpful to at least get you in the general ballpark.
Absolutely.
But for the most part, there's some stuff that AI will never catch.
I agree. And the one caveat in healthcare, especially in the realm of PT, let's just say, AI can still not feel something for that patient, right? Where in your profession,
empathy. Yeah,
you have connected to that patient, and PTs are a great example because you are very intimate with that patient. The care, the diagnosis, etc. And you want that patient to get better, right? You don't want to see them in pain. I don't think AI has the capability to feel that. I mean,
maybe one day AI will have empathy. I don't know.
Oh yeah, not my lifetime, so I won't say it. But I think that's the missing part. And the same with the radiologists. The radiologists are still, there's a human being on the other side of that scan they're looking at, and they're even subconsciously aware of that. Yeah.
So really, is what I'm hearing with your summary of your role is to improve the patient experience through utilizing technology to help us be more efficient in what we do. Is there anything you add to that?
I would say, and I think if you want to throw under efficiency, just the ability to diagnose better, right? I mean, that's the thing. The technology, and we're talking about MRI right now. There's a lot of imaging technologies, but MRI is, I think, one of the best. You have a tool that will allow you to basically see inside of the human body, right? At such a microscopic level that you can see. I just always say you can see everything, right? And I mean, it's a wonderful technology for a practitioner to have. I don't know how they did it 50 years ago, right? There was a lot of guesswork. Not as much guesswork now. Yeah,
and especially in the clinical setting, we would have people with concussions come into the clinic, and we're doing our different screening techniques that we do, different tests and measures. Maybe we had baseline testing to compare it to, but there is so much guesswork involved based on the symptoms of the patient, but the patient's perception of their symptoms can drastically change so much. It's hard for clinicians to be very diagnostically accurate because we go so much on what the patient presentation is. And you have someone that's just like really hardcore, or they have a hard time, explaining themselves or, articulating how they're feeling, and that will essentially create the treatment plan for them.
Right.
But if they have a hard time being a historian, how do we give them accurate information? And now this new technology, we'll dive into a little bit later, but is helping us be more diagnostically accurate with objective findings rather than subjective findings, right?
Yeah, and to the degree, as an example, like something you would probably see is a rotator cuff tear. Maybe, you can be so exact in the diagnosis as a radiologist and from an MRI that I can tell you that 47% of the fibers of a tendon are torn.
That's amazing.
But you can, and if it's read really accurately, which I like to think our radiologists are the best, and they're very accurate. But
I'll tell you a story about one of your radiologists. And
I probably already know who it is.
They saved this patient's life.
Yeah.
Well, she ended up passing away. It was a really sad story, but I'll tell you the story later. But this radiologist called me immediately before this patient left. And I'll tell you the story here at the other end of the podcast, but keep going.
Okay. What you're saying. Yeah. And anyway, they can, so as a clinician, you can say, okay, is this patient a candidate for continued therapy, or do I need to send them to an orthopedic surgeon? You have a decision making that is so much better. The ability to decision make so much better by having such accurate information on this patient. Yeah. And it's huge for the patient too. I mean, are they going to be surgical or are they not? Or maybe surgical and PT, but you can decide that so much,
Yeah, I just presented a rounds with a bunch of surgeons and medical doctors on this bill that we passed to become primary care provider. Yep. And we've been able to order imaging for multiple years now as physical therapists. Mm-hmm. And what's written in the bill is the requirement of collaboration. And a lot of PTs don't know this. They know we can order imaging, but they don't know that the intent of the ordering the imaging should be to collaborate with someone else. Right? Someone else on the medical team. Your job as a PT is not to read the MRI and make up your own decision on what needs to happen next. It needs to be, okay, I see these findings. I need to get an orthopedic surgeon or orthopedist involved, or some other profession to help me make a decision and help the patient make a decision. And that's critical. You get these MRIs where you have 47% rotator cuff tear. What do you do with that, right? We should have a surgeon be weighing in on that. We should have a PT be weighing on that, and maybe a few others as well, but ultimately then the patient can make a decision based off of a team approach rather than a surgeon saying this is absolutely necessary or a PT saying this is absolutely not necessary, right? But then you get all the research, get all the biases involved, and then you get to make a decision as a patient. Right. It's incredible.
Right. And don't you love that collaboration feeling?
Oh my gosh. It as a clinician, it makes me feel so much more confident. Doesn't it? I'd say 20-30% of my job throughout the day is just collaboration with other providers. I'm like, dude, I'll just text my surgeon buddies. I'm like, hey, what do you think about this MRI? Can you look at it this morning? Like, this is happening this week, right? He's giving me his input on the MRI. Hey, should I have him see you? Or, would you prefer I just, keep him in the clinic? What do you think? And, this particular surgeon was like, yeah, keep them for 3 weeks, see how they do. And if they're not progressing, let me know. Yeah. Right. And then I can confidently tell the patient, this patient actually was going on a trip to the, Galapagos Islands in 9 days, right? She was in a car accident literally 3 days ago. I got 9 days to make decisions on if she's appropriate to go on this trip. And there's a lot of hiking, right? She can barely bend her knee. I'm like, all right, we need everyone involved, including you, including mom. Like, it's a minor, but ultimately it helps us be really confident. And the patient as well.
The patient especially, right? Because they're like, I know you've spoken to these other people.
Yeah.
And so there's a lot of really great, and I know who you collaborate with, a lot of them, and those are fantastic physicians, right?
Yeah.
And so much confidence in that. Yeah, it's terrific.
For sure. Well, let's dive into the concussions. I love talking about concussions.
Yes.
I don't know if you know this about me, but I used to race motocross, and I've broken over 30 bones and had 10 concussions. And I wish I would have kept all my helmets, because some of my helmets don't have a face anymore. They've been cracked on the side. You know, sometimes they've been blown out the whole shell.
Which is super cool,
and
right?
You're probably like, well, it makes a lot of sense, you know, but had a lot of head trauma in my life. And, you know, I don't even know if I've managed them right. I did a lot of, report, and actually I can say as a clinician now, I know I did not manage them correctly.
Right.
You know, as a teenager, I had none of this knowledge, nor did my parents. And, you know, tell us about this invisible injury and what concussions really are. Define that for us.
First, I have to ask you, do you still ride at all?
You know, 2.5 years ago, I broke both my hands.
Did you really?
And as a therapist, it was this wrist, scaphoid. I had to get it pinned together, and 2 bones in this hand. And as a therapist, it set me back.
That's your profession.
And it was a very dark point in my life. And I have not been on a bike since. That one, you know, I was mountain biking earlier this week, but I have not been on a motorcycle since. I need to get back out, but I'm still, you know, trying to find that middle ground. You know?
Drive slower.
Yeah, people say that.
No more jumps.
Most of the time, it's when I'm driving slower is when I get hurt.
Oh, that's funny.
This particular, when I ride aggressive, I'm a really good rider. Yeah. You know, I got to the point where I was raced 1 pro race, so I could say I raced professionally.
Yeah,
you know,
you can say that.
But with this particular wreck, I was riding up an ATV trail, just like second, maybe third gear, just kind of going 20, 25 miles an hour. And in the middle of the ATV trail was the grass, right? Taller grass. And I was riding, I was kind of crossing over between each one as it's going up this trail. I'm just kind of moseying, watching the rest of the group, and I hit a rock. And it just slammed me down, and my body went one way, my bike went the other, and I was holding on, and that's what snapped my wrists. And I came down and blacked out for 5 minutes, and they almost life-flighted me. We were 50 miles into this loop.
Wow.
And we had 50 miles to go.
Oh.
So I rode 50 miles going back. Really? I mean, it was like around 40 miles going back, but yeah, I had some braces in my backpack. I always tell people, like, if you're riding with me, I got everything in my backpack to save my life. This is not for you. This is for me. But yeah, I got some braces. I taped it up, and they were so swollen by the time I got back. But ultimately, yeah, I've had a lot of head trauma, and you know, concussions has been a huge just passion for me.
Yeah, I can understand that. The invisible injury thing is pretty accurate. And as a clinician, you see this. It's very subjective a lot of times trying to evaluate these people and their symptomatology. And I think, you know, over the years is one of the more difficult injuries. You know, traumatic brain injury is one of the more difficult injuries to diagnose and treat.
It's concussion and traumatic brain injury.
I lump them together. Yeah, I lump them together.
Why do we now lump them together?
Well,
we didn't used to do that.
So interesting. They're really close to reclassifying traumatic brain injury. I don't know if you know that. I was at a TBI conference. I don't know if you didn't go to that one in San Diego. And Jeff Manley, if you know who Jeff Manley is, he's a guru. UCSF. Yeah, he's written more white paper, neurosurgeon, PhD, which is crazy. He spoke. It was very enlightening. I spoke to him after his lecture there. Just a great human being. But they're in the process, really close to reclassifying traumatic brain injury and giving more specificity to mild and moderate.
Yeah.
And how you diagnose it and what the repercussions are, because it's a very old standard that was classified. I don't even remember how many years it's been, but it's due for an overhaul. So there's a lot more attention being given now to traumatic brain injury, and which is fantastic, right? And with that caveat, with so much more interest in it, there's a lot more interest in being able to diagnose it better. Treatment's a totally different thing.
I just heard someone the other day that actually hit a car on their bike.
Yeah.
And I asked them, I said, did they have a concussion? And this person said no. How do you know if you've had a concussion or you need to be evaluated for a concussion?
I mean, that's a great question, and it's probably a better question for you as far as clinically. I mean, because the symptomatology runs the gamut. It's everything.
Mm-hmm.
I mean, literally, if you ever look at the symptomatology for a concussion, it's almost everything that you can experience. And sometimes it's a time factor, and that's where the thinking has always been, is like, well, if your symptoms go away in 2 weeks, you're fine. Well, are you? Do you have just brain fog lingering for 6 months? Is that a bad thing? Do you get dizzy when you didn't used to consistently over the next 1 to 2 years? I mean, these are things that can be subtle for some people and sometimes debilitating for others.
Yeah.
But something's changed inside your brain, and what is that? And is it serious?
For sure. I remember driving. I used to work at FedEx when I was in college, and I had a concussion. Mm-hmm. And then I went to FedEx the next day. And then if you can imagine like a big warehouse, and there's probably about 30 forklifts weaving in and out of each other. There's lights coming from the ceiling, and a lot of noise. Right. And if you know anything about concussions, that environment is very overstimulating. Mm-hmm. Right. And I remember I would be driving down the dock, loading different freight into trailers, and hearing all the noise. It was so hypersensitive. I had to wear earplugs because it was too stimulating. And the lights were just so bright. I just couldn't keep my eyes open. Mm-hmm. And I had to wear shaded glasses. And at the time, I didn't know anything much about concussions. This was kind of like my early undergrad years when I started first studying them. But there was so much sensitivity, and I would go in trailers and just sit there for a minute and just do this because I didn't want to see anything peripheral. I'd close my eyes, and I didn't realize I had a concussion, right? But those are a lot of the symptoms. If you have those things, the brain fog, the memory, even if it's short term, like these things that are lingering, light sensitivity, sound sensitivity, those are all symptoms of a concussion, and they need to be treated as such.
Yeah, and I mean, I know we don't have time to jump into treatment, because that's heavy lift, right? There's a lot there. And the interesting thing is where research is going now, and I think why so much attention is given to this is these brain pathologies that are hitting people later in life, and there's tons of examples, especially in these high contact sports, because they get a lot of media, but is what does this neuroinflammation do over time? So I've gotten concussed. Maybe I'm not so symptomatic anymore, but I've started a process in the brain that's inflammatory in some respect.
Yeah.
They are now tying that to diseases like Alzheimer's, dementia,
famous CTE.
Yeah, and Parkinson's, you name it. A lot of these neurological pathologies are now being linked to concussions that have happened previously. And I'm not saying if you have a concussion, you're going to get a disease. I'm not saying that, but there is absolutely something to be said for this neuroinflammatory process. And what is it doing over time? And is it throwing you into a category of, setting you up for something later in life that you wouldn't have otherwise experienced?
A lot of people don't even realize that even a fast stop, right? Say you don't even hit your head. There's a term we use, coup contre coup, where essentially the brain sloshes forward from an immediate stop, and then the brain sloshes back, and essentially that whiplash motion. Yeah. But you can get concussions both in the front of the head, front of the brain, and in the back of the brain just from stopping really fast
without hitting your head.
So it was actually a PT I was talking to. It was her husband that hit the car. He was going 30 miles an hour, and the driver turned into the lane, and he hit the side of the vehicle. I'm like, there's no question in my mind that man has a concussion, right? Whether he hit his head on the car or not. Right. That was a very quick stop, and your brain cannot handle that immediate of a stop. So I'm going through like, does he have any light sensitivity, right? Does he have any sound sensitivity? Is he irritable? Is he sleeping more? Like all these different things. So I'm like, there's no way he doesn't have a concussion.
Yeah. Yeah, I agree.
Because some people think just, I got to hit my head.
Yeah, that's a really good point. Yeah, you're exactly right on that. You don't need to.
Yeah, so tell me about the advanced imaging technology. What do they call it? What's the new terms? And how is this going to help us diagnostically help our patients?
Yeah, I mean, and there's several technologies, I'll say, that are tied tied to MRI, and obviously the most acute one is CT, and anyone who gets a injury into the head that's significant, you go to a hospital, you're going to get a CAT scan, which is a fantastic tool for to look at the brain immediately for any kind of hemorrhage.
Yeah, tell me the difference between a CAT scan for those who don't know and an MRI. What is that looking at?
CAT scan is radiation. It's a different technology. It's much better at seeing again, acute injury of the brain, fractures, things like that, than an MRI would be.
And why would you use a CAT scan versus an X-ray?
CAT scan, because if you're doing brain, if you're talking about brain, X-ray is fairly useless but for bone, X-ray is a great tool. A CAT scan can actually see a lot more detail where an X-ray cannot. So if there's a question on a fracture, you go to a CT if you've done an X-ray.
Yeah.
But in an acute setting, you're going to a hospital.
Why would a clinician choose an MRI versus a CAT scan for a brain injury?
It's usually a
for
window.
Those who don't know.
So 24-hour window. The first 24 hours, you do a CAT scan all day long because you want to rule out the big thing of any kind of a hemorrhage.
And a hemorrhage is internal bleeding, right?
Mm-hmm.
So the shearing of axons, or could be a brain bleed.
Yeah, and it's
right. We're looking clinically, we're looking for a pupil dilation.
Yeah,
right. Where blown pupil, because you can have a brain bleed, and there could be so much swelling. Essentially, it could kill your brain.
Yeah, and I mean you die. Yeah. So you want to make sure that's okay.
And CAT scan 24 hours, and then
you move into the MRI world. And the MRI can still show you that stuff, but also a CAT scan takes 3 minutes. MRI is 20 to 30.
CAT scan's pretty cheap.
And
cost-wise.
And then, again, in a hospital setting, it's all about throughput, and they need to get people in and out. You rarely see them go to an MRI.
Minutes.
Yeah.
And especially if your brain's bleeding. We don't want to wait 25 minutes either.
Right. So that's sort of the difference. But then you jump into the realm after that, after a CT and after that window. Really, MRI is the gold standard. And there are a lot of different modalities within the MRI over the years that they've used to look at the brain, specifically for traumatic brain injury. fMRI has had its merits over the years. Functional MRI is what it's called. And it's more of a cognitive tool, and not as well accepted. It's used a lot in research, and it's a kind of a blood flow thing. The patient actually interacts, does tasks, mentally during the scan. Not widely accepted as a traumatic brain injury tool, though. Not like some other things. There is also, they do what's called DTI has been sort of the accepted way, and that's diffusion tensor imaging. Part of an MRI scan has been the accepted modality for quite a while. As we advance in that world, there have been some issues with DTI, and most prominently the way the brain is built. I mean, what you're looking for in a scan is white matter and what they call diffusion. And we have millions and millions of axons.
White matter, if a patient wants to look at this or Google this, it'd just be the white portion on the MRI versus the black portion.
Yeah,
right?
Good way to say it. And it's filled with millions and millions of axons. And those axons are what you're looking at. So,
and axons are really just the communicators, right?
More or less, yeah.
Sending signals, travels
all
over to the feet, to the head, to the face.
So it's a pretty significant part. Yeah. It's important.
So if they tear, all of a sudden you get lack of communication between those other parts.
Depending where it's at, right? Yeah, where the injury is. Yep.
And that's, I think, the most important thing with the imaging, what this is telling us, is where in the brain is it happening? Because clinically, as a diagnostic clinician, I'm just doing my tests.
Right.
Is this in the occipital lobe? Is this parietal lobe? This is the frontal lobe? This is the temporal lobe? I don't know where in the brain it's happening, and it takes some extensive investigation to find it.
Yep.
But from my understanding, these new MRIs and this new AI technology can pinpoint exactly where it is for the most part, right?
Yeah, and that's the new part. So the DTI I was speaking about has been around a while, and the issue that they've discovered with it is that you're looking at all these millions of axons. axons cross 80% of the brain, and DTI accounts for axons being in a straight line, but the reality is somewhere in the 80% or more actually cross. And when they cross, it can create you can't diagnose as well what that axon is doing, meaning the water travels through axons. And so if you think of it as a straw, each axon, millions of them, is a straw, and water travels through that straw. When they're damaged, that straw basically leaks, and then you have diffuse water everywhere. And that's what the scan picks up. Well, with these crossed fibers, with these crossed axons, you can't necessarily tell so well if it's injured or not. So recently, and this is the interesting part, a company called Imica out of Canada, they've been around probably 15 years now, but just recently have come to market with this scan that uses AI and what they call advanced modeling. The advanced modeling takes into account any crossed fiber that it scans, which is super cool.
That is so amazing.
And they have an FDA clearance as of a year now. And when they first came on the scene, and I met them about a year and a half ago, they said we were working on an FDA clearance. I'm like, you're never going to get it, because nobody ever has. And they achieved it. And so you're now looking at the brain on a microscopic level, all of the axons, and you're able to tell specifically 33. They're all bundled into 33 groups. They're all 33 groups of the brain. The axon fibers, where it's damaged, to what degree, and they have.
Can you tell where it's been damaged in the past?
That's the problem, is not as well. Now this is very specific. So as a clinician, if I'm really, really good at what I do, I would understand this area is the damaged area. What do I need to do to rehabilitate this patient? And then I can
focus my treatment on that specific thing rather than give them a global approach. I can give very specific criteria to your treatment plan because I know exactly where it's pinpointed. And our diagnostic tests in the clinic can get a general. It's kind of like a shotgun approach versus sniper rifle.
Exactly.
I'm just treating a concussion versus I am treating a temporal lobe right-sided concussion. Right, and then I can target those specific things. So I love this technology.
And we're just seeing now, because we're working with a lot of clinicians locally using this.
So does Rayus have all this technology in all their imaging centers now?
So we have it in 4 states. We're rolling it out slowly.
It's in Utah right now?
It's in Utah. Utah is where we piloted it.
So all your locations in Utah have this?
You have to have specific software on the machines. So we have 3 or 4 machines now that do it here locally. But
what locations do you have?
You're going to ask me that, aren't you?
Yeah.
I'm going to say South Jordan.
You're kind of removed from that, I'm sure.
As
long as South Jordan has it, we're good.
That's all I care about.
Do you have to, so when you are, say a clinician, you're ordering this imaging, do you have to put Imica
you do.
Technology, AI specific, like that type of thing?
You have to put, it's actually, the product's called ANDI, ANDI, Advanced Diagnostic Imaging, and that's what you would put if you were to order it. Okay. And I will tell you that commercial payers...
So you mark MRI, but then ANDI Technology, and then anything else you need to write on the order?
That's it. And then they'll do a brain and they'll add this. And there's no extra time in it or anything. It's just a processing thing. But I will tell you, commercial payers aren't currently paying for it. It's new. There's a code for it.
Pocket for it.
You do.
So roughly probably $400 for the MRI.
And
is
that's
it more?
much more money than that.
Okay. So regular MRIs around that.
They're very proud of their product. There's a cost. Commercial payers will pick it up in probably a year or so. It takes a while. And they're new. It's a year. It's a year old.
Yeah.
But we're just now seeing...
Sorry, go ahead.
Oh, we're just now seeing where clinicians who are starting to treat these, who have done this scan, are doing a post-scan.
Yeah. 6
months later. And looking at the areas of improvement. And I've had such great conversations with these clinicians because they're like, we've dialed this in. We're like, the patient's getting better. Look at the improvement on the scan in these areas that we're working on.
How is this helpful for the patient? How is this technology going to help them in the end?
I think it goes back to the whole point of, what is the concussion doing to them long term? You know, what is it going to look like in 20 years? You know, and again, maybe nothing, but maybe like something.
You know,
right? I just keep thinking I need to scan your brain now. That's where my head goes. You know, you told me about all these concussions.
I don't know what posts we're gonna do,
right?
But
right.
Better get a baseline to see what my brain looks right now.
I think we're moving into the world of baselines too.
Yeah. And do you ever foresee like a baseline scan for a preventative measure, almost like a physical?
So
like
this is
everyone's kind of not necessarily required, but it's paid by insurance.
Yeah.
You get a baseline, brain exam, because then you're in a car accident and we have your baseline of what this looked like before, right? And of course, there's aging things, degenerative things that happen, right, as you get older. But ultimately, we can compare where you were 5 years ago in that specific lobe of your brain. You get in a car accident, and then we know exactly what it used to look like, and then we do a post one after rehab to get it back to where it was in the beginning.
Yeah.
You know how cool would be that? Do you foresee that in the future?
I'm working on that. Like this is my passion. I mean, I'm a fan too, and we aren't talking about this, but the whole body MRI, which I think people are being much more educated on now because there's some companies that are doing a lot of advertising for it. But again, 5 years ago, this technology didn't exist, and it's Star Trek, and really where you get in, you scan the entire body. That didn't exist 5 years ago.
Yeah.
Now it does, and you can detect cancer, you can detect pathologies. The brain is just another piece of that, and arguably probably the most important part of your organ in your body, right?
Yeah,
and
it's running everything. I mean,
so I see a future where you're getting scanned, and you get all the data. You get data on your entire body. Cancer screening, whatever you want to call it. But for the brain, what does your brain look like comparatively? Is it healthy? Is there pathology, concussion, or whatever? I
want to get back to that data here in a second, because sometimes this data is very harming for patients to hear.
Yes.
Right? I want to really hear your thoughts on that. But also, say I order this imaging and I put the Andy technology. How does the information come back to a clinician?
So it's really
just super specific. And
two pieces. So, and it's a long report. I will tell you this. And
I did hear that it's like
I'm very close with Imika. I mean, they're just literally some of the best people I've met in my lifetime. And the CEO is he's an ex-speed skater, which is super interesting, from Canada. And I don't hold that against him, right?
I'm glad
we always get in arguments, but the reality is that. What was the question again, though? Because I kind of missed it.
Because how am I getting that information back?
Oh, yeah. So they produce a long report.
It's like an 18-page report.
No, it's 40.
40. Oh,
so
way off.
This is where I was going because I was explaining to the CEO and I had this conversation. They have an FDA clearance. Mm-hmm. The FDA clearance you have to adhere by it exactly. And part of that clearance was this 40-page report. Mm. So they can't create a 5-page report, even though they would like to.
Yeah. Let's summarize it.
There is summarization in it once but you do get a 40-page lengthy report looking, again, at every microscopic level of the brain. But then you also get the radiologist. We have a radiologist that looks at it as well. And they look at the brain for pathology, and then they look at the report, and they look at the Imika study, and they tie it all together. And they're like, these are the areas of concern. They have to agree with it from what they're seeing on the scan. So you really have two components, and I will say the radiologist summarizes it in a really good way.
Okay.
So
we get a 40-page report, but a summary as well.
Yeah, it's a scary. I mean, I tell every clinician, it's a long report.
We got all the time in the world, right? In healthcare, we got plenty of time.
It's a cool
to read
report, though. Yeah. Yeah,
but bells and whistles in it too, and maybe a few gifts and
right. It's that good. Yes. Yeah.
Love it. So let's spend a minute on, as a clinician, I have a bias, and this bias is I personally don't like my patients to read their own MRI. The MRI report from the radiologist. And research has shown, the many articles I've read, randomized control trials, systematic reviews, that patients, when they read that, their pain perception actually increases. Mm. So say you have back pain, you get the MRI, it's sent to the patient without the physician or clinician filtering anything for them, and they see, oh, I have degenerative disc disease.
Right.
I'm like, well, you and 70% of your population, right?
Right.
But all of a sudden they put this label on themselves and their back pain increases 3 points.
True. Yeah.
It was a 4 out of 10 pain, now it's a 7.
Right.
And I'm not like over exaggerating that. Literally that's what the research says, right? And then they get all this compiled factors, right? Disc height is significantly changed, right? That, nodules, like all these scary words
there's a lot
that they read. And my biggest worry is when we get these full body MRI scans and they get all these labels, essentially it medicalizes them and they're like, think they're fragile.
Yes.
You know what I mean? So what would you say to that as we go into this new wave of the future and people are getting these full body scans? How do they curate? How do they filter this information without being debilitated or influenced negatively by it?
Yeah, I don't know if I can answer that well because we're humans and there's just that's just the way we think.
Do you
right?
foresee that physicians need to be involved in these full body scans to help kind of filter out the white noise and what really doesn't matter?
Yeah, and I think there's actually a large portion of detractors to things like whole body MRI. A lot of physicians don't necessarily like them because the information, there's a lot of what they call false positives, which are true. Yeah. The data has shown whole body MRI.
Just life changes, your body's going to change. And when it shows up in an MRI, we call that degenerative disc disease. Yeah. But purely, it's just change. Yeah. It's adapting. Yeah. Based on life, Yeah.
But then you take that percentage of patients. Here's my argument to that is, maybe there's some findings, maybe some are false positives, but then I think the data is like somewhere like 7 or 8% of people who get whole bodies detect cancer and can prevent it. So what does it mean to those 8%? Like you saved 8% of these people's lives. Was it worth it? Was it the other 92%?
Never lifts weights again because they think they're fragile.
I
think, never exercise again. That's my biggest worry, right?
Yeah,
the 8% is really crucial. How do we get it to be empowering information rather than debilitating information?
Well, I hope it makes people chase health. I don't know. I guess that's it, right? And with again, the clinician part you mentioned just a second ago, having them involved, where they you want the clinician to be passionate and be involved with their patient, right? You don't want them just to blow everything off and just say, well, you're just getting older. But what can we do preventatively from this point to keep you from getting worse?
Yeah, because we're really seeing this shift in healthcare of, imaging centers and, as a whole, even PT, marketing to the consumer.
Yes.
Right? We want them to have informed choices and decisions, right? But I really want to empower the healthcare community to find great clinicians that can help guide decision making, right?
I agree.
Even knowing you choose to get these images, there's stuff that you just don't know that can be really harmful for you if you read it on your own. You don't know how to actually think it through, right? And if you can have a great team around you, they can help filter a lot of that. They can tell you what's important and what's not important. Because if we can detect 8% that have cancer, man, we do it early. We talk about prevention. That would be a huge amount of lives saved, right? And then if we could get this information to the public to empower them rather than be hurtful to them, then it's a win-win, right? So ultimately, in my mind, it's creating a team approach to get everyone involved, the patient included. The patient can be the decision maker to say, I want to get that scan, but they also can make a choice to say, I want professionals to help me interpret that scan, not just go off of what the radiologist. There's a reason why the radiologist doesn't report that to the patient, right? Radiologists don't do that. It's not their job.
That's not their job. You're right.
It is the clinician or the physician's job to explain and filter what's important and what's not, right? And I really foresee a future of empowerment with these images for people.
Yeah, I agree. It's funny you say that too, because it's surprising how many times we get calls from patients wanting to talk to the radiologists. And that's not their job. It's the job of the clinician. And the response we get from the patients are well, the clinician's not talking to me about my scan
Yeah.
or about my imaging, and then you just kind of gotta take
cringe a little bit.
Yeah,
You're like,
you do.
Dang it.
You're
We
like,
missed
it's not
an
working.
opportunity, right?
Yeah, yeah.
And you almost want to reach out to them. You're like, can you reach out to your patient? Do you know? Because it is hard as a clinician to be, communicating with all your patients. But it's crucial. Hard. It's critical to helping them really understand what that means.
Yeah.
But I'd say to the patient, if you haven't had your physician reach out to you, whoever's interpreting, the findings from the radiologist, just keep reaching out. You know, it's not that we don't want to interpret those for you and help you. It's purely a volume thing, and sometimes we do need a few reminders to really get that information. I actually had one this morning where I didn't get back to the patient for 2 weeks. Our front office manager had uploaded it, sent me a message that it was uploaded. I got busy with 12 other things. I'd accidentally opened the email and then didn't go back, right? So it's purely, we're human too.
Yes.
And we need reminders sometimes.
Absolutely. And this is probably a different podcast at some point, maybe, if you ever invite me back. But we are converting one of our imaging centers. Do you know about that? No, the South Jordan Center is being renamed. It won't be named Rayus. It's a whole new model for patient centricity, and where patients can actually come in and get imaging without a physician order.
That's awesome.
At a really affordable price. And then we can tell them
marketing to consumer here.
It's direct to consumer. And we want to make access to a lot of imaging that is very difficult for them to get through their healthcare systems or through their physicians, that they can come in, again, a highly affordable price.
Yeah, what I love about Utah, we're one of the most health-centric states in the nation.
Yes.
But what's interesting, based on the U.S. Department of Human Services, based on their survey, that Utah is harder to get into for primary care physicians than any other state. And we're the second fastest growing state in the nation.
This is so unbelievable.
The numbers aren't really adding up.
It doesn't
right?
make sense.
This model is a beautiful model to give information to patients that are really conscious about their health. What I really would love is if we could get people, like almost like you have a list, like here's a bunch of physicians in your area, or like you're directing patients to physicians and clinicians that can help them interpret those findings.
That's the plan.
Yeah.
So a practitioner will sit down with them and say, hey,
That's
again,
awesome.
Maybe you have a rotator cuff tear. Here are a list of physical therapists in the area that you could go see, because they have not seen anyone yet. We're just giving them the information, and they can take it where they need to take it. Yeah.
That's awesome.
Yeah.
I love that. I love the consumer's ability to be empowered with information.
That's the whole idea. It's called Your Health in Your Hands is our tagline.
Yeah. I
so
love
that
it.
they can kind of control it.
As we kind of wrap up this podcast, what other things, along these lines that we've been talking about, would you like the public to know?
Oh, as far as like imaging goes.
Yeah, imaging, concussions. Like what do you hope to see in the next 10 years?
Yeah.
More on the public's end. What do you hope that they do with this information?
I mean, I think it's and we've talked a lot about being proactive with your health, from the imaging standpoint. And I think you do have people who don't want to know. Mm-hmm. Right? There's a large population of people who don't want to know.
It's like, I'm good.
Yeah. And the truth
I'll end
is,
with the story of your radiologist, the patient that did not want to know.
Yeah. And the thing is, we're all getting older. Things start to compound, I think, when you ignore them. That's been my experience from a clinician, and even personally, if you're not careful. But it's really you do hope that people take their health seriously, because it's just that one thing. It doesn't matter who you talk to. The wealthiest people in the world who have everything, supposedly, when they lose their health, there's everything. Nothing matters. Yeah. Like nothing else matters. And I think anyone who's experienced things like chronic pain or chronic injury, it's so debilitating. Yeah. Right? And you just want to do everything you can to prevent it. And my hope is that people start earlier in life instead of waiting until they're 60 or 70. I love that. Right.
Start now.
Yeah, honestly.
And that's really one of the solutions that we want to present is start early. Mm-hmm. Do work on the prevention. That quote, like, I can't remember what it says, but, ounce of prevention is worth a pound of cure or something like that.
Yeah.
Like, if you can literally prevent the majority of disease just by detecting it early.
So true.
Right. Mm-hmm. And, we talk about the problem of, access to primary care and all these different things that are going on, or growth, but we're creating solutions for them.
Yes, you are.
This is one of them. This is we're empowering you to make decisions early, but you have to make a choice to be involved sooner, not later.
So true.
And this patient, it was a mid 40-year-old gal. She was different ethnicity. I won't go into specifics there, but she essentially was avoiding this gut pain that she had had for multiple years. She just thought it was, irritable bowel syndrome, stuff like that. And she came to my clinic with some back pain. And she told, in the end, she didn't want to know the information, but she had this debilitating back pain that she got just from picking up a weight in the gym. Very, very exercise-centric person. She was very active. Came to my clinic just off the street with back pain. And I got 3-4 sessions in. I've treated a lot of back pain, in my 6 years of treating, and more than anything else. And I've gotten really good at treating the back, but this particular case was really challenging, and it wasn't out of the ordinary, just like really intense, acute low back pain. But I know when things aren't going right. I've treated enough to know when it's not following the normal pattern. And we got to visit 4 and got a little progress. So I was like, okay, I'm appeased, right? And then she came back in and she said she was laughing with her friend all night and now could barely walk. She's holding on to her husband, literally taking small steps. It took 30 minutes just to get out of the car. Wow. So she was like 20 minutes late for her appointment. And I just told her, I said, that's one of the red flags that we really are conscious about. I'm going to send you for an MRI. I want to see if I can get you in today, because we got to figure, there's something going on, right? And I don't want to scare you purely. We just got to find out information before we get moving forward. Send her for the MRI. Lauren Z, that's all I remember from the MRI report. She calls me up as soon as the patient's done with the MRI and says, this patient has multiple tumors all up and down her spine. She's got, I'm estimating, like 17 fractures all throughout her spine. One of them's unstable. I just wanted you to know before they left our facility. And as a clinician, I am so grateful for her that day, because that patient could have gone home, unstable fracture, could have been paralyzed. Right? So I called the patient. I called the patient's husband. He was a good friend of mine. I just told him, I said, I'm so sorry, but I have some really unfortunate news to tell you. This is going to change your life forever. But I need you to go to the emergency room right now. She has an unstable fracture, multiple fractures all up and down her spine. Really sad story. She ended up passing away 6 months later. And what it comes down to is I screened all the red flags. I asked her if she had night pain. I asked her if she had any changes to her bowel or bladder. She was denying that she had changes to her bowel or bladder for years because she didn't want to hear it. Right. And ultimately, this podcast is a lot about that. Like, prevent it. There's so much you can do to prevent what you have and what you could have in the future. This gal had 3 young kids, and who knows, could have prevented all of this just by detecting cancer early. She was in her mid 40s. Right. But she just didn't want to, she ignored all those health things and just didn't want to see it. Right. But she could have prevented it the minute she had the symptoms. She would have acted. So any other concluding thoughts as we wrap up this podcast? This has been a very empowering conversation.
It's been fantastic. I mean, I don't have any concluding thoughts. I just appreciate you inviting me. It's fun to talk about this stuff. I love to see where your profession's at right now. You guys are fantastic.
Well, thank you. We're really trying. PT has been kind of in the shadows for many, many decades. And, our profession is going from associates to bachelor's to now doctoral degrees. Awesome. And it's evolving. And it's really creating the whole, holistic approach. We're looking at human beings rather than just specific organs or specific muscles. And our profession's coming together and just saying, we are centered perfectly to help more people than we ever have before. Right? We are an entry point to be able to help people get back to their full capacity of health. And we're just really excited about this revolution of a team approach and working together, and appreciate all that you do to build this in our community. So thank you for being here today.
Thank you. Appreciate it.